So big point is SIRDs. So these are selective estrogen receptor degraders. Everyone is very excited about this, and with good reason.
Yes.
So what are SIRDs? Very briefly. So we have our tamoxifen, we have our aromatase inhibitors, and aromatase inhibitors block estrogen production. So there is less estrogen or no estrogen to bind to any cells that are circulating and have an estrogen receptor. What SIRDs do is they actually don't go after that circulating estrogen, but they go after and block and degrade the estrogen receptor. And there's a number of different SIRDs already. Faslodex is a SIRD that has been around for metastatic breast cancer for a long time, but it's an injection and it's not very effective. So now we have on its own, it's effective in combination with other medications. But now we have a number of oral SIRDs. We have several approved in metastatic breast cancer, and more are coming. There's a lot of nuance and research being presented about how to optimally use them. But the big news is that we're hopefully going to see an approval for the first oral SIRD in early stage breast cancer by the end of November of 2026. That drug is giredestrant. This is on the basis of the lidERA trial, and I'll briefly talk about that. So they took patients with stage 1 through stage 3 breast cancer, and half of the patients got their tamoxifen or an aromatase inhibitor. And if they were premenopausal, they also received ovarian suppression. And then half the patients received giredestrant with ovarian suppression. And what they found was that the use of giredestrant reduced the risk of recurrence by 30% compared to your standard of care endocrine therapy. Also was better tolerated. There were less discontinuations for things like joint pain, which is super exciting. And so that's where we are right now. What they presented in ASCO this year was that there was no difference whether you were using giredestrant in premenopausal or postmenopausal.
But they had to have ovarian function suppression.
Exactly. So
because
yes.
So the reason